If left untreated, some sexually transmitted infections can lead to infertility, and in extreme cases, they can be fatal. But many are curable, and all are preventable. The two most common sexually transmitted diseases look like this under the microscope. But we're not going to use a microscope, we're going to use cuddly toys based on those slides. I wonder if anyone can guess what infections they are.
I think it's salmonella. Something green and horrid.
Don't know, gastroenteritis?
We don't think we have it.
We don't think we know. We hope we don't have it.
Believe it or not, it's actually a giant chlamydia microbe. Chlamydia is particularly prevalent among young people. Studies have shown that 1 in 10 women under 25 may be infected. And it often has no symptoms, but can lead to serious fertility problems later in life. But how about this little fella?
Will I touch it? No! You've just told me it's got a virus.
He's looking at me now.
He's thinking, I know you.
Gonorrhea?
Yep, it's gonorrhea. Gonorrhea is most common amongst young men and women. Again, it may have no symptoms, but it can cause damage to a woman's fallopian tubes and ovaries. But there's one sexual disease that has even more serious consequences. It's a virus that can cause cancerous changes in the cervix, the opening of the uterus. This infection is so common that half of all women will have been exposed to it within the first 4 years of having sex. If you're sexually active, it's very likely that you've been exposed to HPV, the human papillomavirus. About 1 in 100 people who have HPV infection develop genital warts, but the vast majority have no signs or symptoms at all. But the infection does have very worrying consequences because almost all cases of cervical cancer are associated with HPV infection. That's why regular smear tests are so important. When a sample of cells is taken from the cervix, precancerous and cancer cells can be identified before it's too late.
This is the speculum, Sarah, and we're going to introduce it as far as the cervix. It'll be a bit uncomfortable, but it shouldn't be painful.
But there's always been a bit of reluctance on the part of women to have regular smear tests because of the anxiety, embarrassment and discomfort. But new technological advances have been made to the cervical screening programme in Britain, which Rachel is keen to see. The old method of collecting the smear with a wooden spatula is out. There's too much chance of blood contaminating the sample. And in comes a plastic brush. It causes less discomfort and gives a much clearer read.
Welcome to Marketplace. U.S. stocks rose in early trading after